Welcome back to the Spartan Nurse Podcast. I'm your host, Dr. Mike Martell.
And I'm the co-host, Dr. Krista Reeves.
Today we are grateful to have Dr. Rhonda Conner-Warren join us on the show. Thank you for coming on today.
Oh, thank you, my friends, for having me.
Can you share what inspired you to pursue a career in community health nursing and really how it led to you teaching?
Well, that's two things. There's the pre-nursing, meaning coming from your family. So my grandmother was the oldest of 10 children. So she was always caring for someone and caring for someone in the community. Then you move it on to nursing. I'm a peds person. And so once again, when I first started, children stayed in the hospital for years sometimes. And once they were able to take the equipment and move it to home, then they realized they really didn't have the staff to do so with this equipment. So then we were recruited to go out and see patients in their home because we had care for them in the hospital. And so that's what I did. So I had kids on ventilators, on feeding tubes, TPN, in the country, in the city, in apartments, in trailers. So I've gone as far as Toledo and as far as Armada. The faces of the family having their child home was the best part. And so I walked away many times with fruit, the harvest, the hugs of the thank yous, and the kid looking like, I'm not a patient. This is my room. Like, did you see this? If they couldn't move, they might just show their eyes, their favorite toys. So it's those things that say this is a family, and this is what I want to do is keep my families together.
I love that.
So what unique challenges and opportunities do you encounter when teaching undergraduate nursing students about community health?
Well, one of the challenges I see the most is getting them to believe in themselves, that they do know stuff. Now we got to take everything that you've learned in 2 years or 3 years and or your life and apply it to a community, a family, or a person or an agency. And that's going to look different based on where you're at. So everything you've ever experienced, you're now bringing with you. So getting them to understand you're not the same person when you started the program. You are becoming. And the other question is now who or what type of nurse do you want to be? Because, again, nursing is the number one group that has that respect, that has that trust, that has that loyalty. And we're going to keep it, but it starts with you.
It is that trusting relationship, but the students have to put forth the effort to create that trusting relationship. So, like, what kind of nurse do you envision yourself being? What do you want to embody in this profession? And it's being able to sit with them, talk with them, be able to provide that empathy, that connection piece that sometimes gets lost with the tasks of being a nursing student. Exactly. So I love that you touched on, just building that rapport.
And then there's also just even the very simplest issue of my grandma knitted too. My family can too. My family are hunters too. Those things, once again, you will see people light up because, well, how did you do it? You're giving that sharing. So to me, learning is a two-way street. The student learns and the patient learns. That's how you build your relationship.
Rhonda, tell us a little bit about how you incorporate those real-world experiences into preparing students for the practical community work, such as things like the windshield survey that they go and do, or looking at different data pieces to really be able to have that practical community aspect.
So one thing I talk about is you can be driving down the same road all the time, but you don't see the community. You see the road. This time, I need you to look at how many stores there are, how many gas stations, how much liquor is being sold. I need you to look at the billboards and where they are and potentially compare them to where you live. So say, for example, there are billboards that say we will deliver liquor, we will deliver marijuana to the home. What does that say in that community that we could have people that are at home overindulging in substances who may have some psychological problems where they need a discussion, but that's not going to happen because they're self-medicating. That's scary to me, that somebody's hurting and we don't know. How about the fact that there are no major grocery store chains, but there are the mom and pop stores? And so one student said, they take SNAP. Most of the stores take SNAP around here, which is a food card. I said, that's a great thing. It also tells you also about the neighborhood, that you may have low-income people who don't have the ability to afford the fresh fruits and vegetables that you and I could, or for their kids as well. So that's a positive. See, those are the things you have missed that you saw, but you didn't see. In terms of safety, because I'm in the Metro Detroit area, you have the green light effect. These are agencies that have agreed, or businesses, to have the green light that indicate we are a protected agency. We have cameras around so that you can feel safe entering in. It might be your only store, but if you feel like you're not safe coming out, then maybe you won't go. And then we have the issue of going back to poor health. You're getting what you have quickly access to, things that may have high salt, high cholesterol, high sugar. So again, look from a different perspective. How about transit authority? I said, no matter where you live, for example, where I live, nice community, I think, and we tell people to get out and walk. We don't have any sidewalks. So now, if you're walking in the morning, do you have reflective gear on? Or walking late in the evening? But they're getting out walking, and we do take care of the road in that area so it's smooth, but that's just not true everywhere. So you're telling someone to get out and walk with uneven pavement, and they're having a balancing problem, or they have the problem of dogs out in the neighborhood. And even where I live, we have coyotes. So that may not be a German Shepherd at dusk that's following you in Snowball.
Oh boy.
Okay? Those are the things, again, that you want to think about and talk about, that no matter how much money a person makes or where they live, are they able to do the things that we need them to do to stay healthy safely?
Yeah, I think that deeper community assessment is so important as nurses. And it's important to consider, like you mentioned, access to care, access to, all those social determinant of health things that come up, access to food, is so many important things for nurses to consider when they're working with patients. So I think that that's really great that you do that out in the community. And I think that's what really, creates a great educational experience for our Spartan nurses is to have that deeper knowledge of their community and how to assess those needs and how to really make an impact.
So that's why some of my clinicals have been what I would call maybe non-traditionals. For example, we went to the garden, where it's a community garden organization, and it was a kids' camp. And so they taught first aid. It was one of our hottest summers, and plus we had the fires here in Michigan. So we're talking poor air quality. So the students also saw the garden, and many had never gardened. So there is a difference between fresh thyme and thyme from the garden and onions from the garden. That's a wow moment if you've never had that freshness on that level. And then how you can put in a reading nook off of a branch of a tree, and the child can sit there and read, encouraging them to do that. But the biggest thing was teaching them first aid and how to be safe, because again, it was very hot. And so I allow the students, tell them, you're gonna use every gift you have, because this is your time to give back. So some of you are probably great actors, and some of you are great artisans, and some of you are great just get the group moving and doing what they need to do, and some of you are great observers. Understand what your gift is. And so again, we did the red dots for heat rash with a marker. We had somebody pass out. So we did this simulated pass out. Okay, now what are you going to do? We took them through the steps, not just read. What's the first thing you do? Make sure the area is safe. And they did it. And again, are you awake? Let's get some cool bottles of water to help cool them off. Let's turn them on their side. And so they did it. And the kids were like, hey, I did that. And so again, the goal is to also instill in the patient that you've got this, that you've got that strength, and we're going to help build on that. And so the students were just like, wow, this is what a community health nurse can do? I said, yes, should do. If you have an organization of this nature, then yes, I think the nurse should be connected so that, again, when it comes to health teaching, we're out here. So again, as the air quality, you could literally see the difference. I said, everybody can't stay inside. They need to go get food or whatever. When should they go? Early in the morning, later in the evening, take your inhaler. Those are the kinds of things we have to help people to understand so that they have the best quality of life that they can have. They even found a slew of cats that were like hiding and calling the Humane Society to see what they could do. That's part of your community, that no one should be abused or left alone. If we can help it, then that's what you're to do.
What a great experience for the students. Wow.
Mm-hmm.
That's a lot that they covered.
With a growing focus on global health and planetary health, how do you adapt your teaching to address these critical areas?
Well, the biggest issue is sometimes it occurs right before lecture, meaning that I have posted the lecture and I have to go back and I have to change it. I believe that it has to have meaning in the now, in real time. So, for example, policy and advocacy. Helena had just come through. I needed to connect all the other competencies or concepts that I've been previously teaching about, family and aging, and again, big number data in terms of seniors and illnesses, to this lecture and about advocacy, as well as we're in a political season and what we're all fighting for. So I took the example of people lost their homes. Homes are security. People lost probably their medicine and wondering how they're going to get it and are still missing. So we're going to have a huge psych issue, period, for a while, just trying to go to sleep in those areas. Mm-hmm. Sleep is a precious commodity and can have a huge impact on your health. Mm-hmm. Then we're talking about, you heard people say, I don't have anywhere to go. Because again, many people didn't think it would ever be that bad. They've been through hurricanes. But now we have to be realistic with global changing. It can get that bad. And you need a plan B. Where would you go? And go to be safe. So again, if you were a community nurse, you would be with the agency in that county to help provide shelter, help get medication, contact loved ones, along with the other agencies. I said, now let's take it back to the hospital or even home care. Baxter plant was hit. Mm-hmm. I saw the pictures. That plant, the water was up to the roof. I said, so guess what? That impacts every IV bag you get ready to hang now, mm-hmm. whether it's at home or in a hospital. We have people at home on TPN. Mm-hmm. We have antibiotic therapy through PICC lines.
Dialysis.
And now the dialysis was the
mm-hmm.
last one.
Wow.
Again, this impacts your ability to care and impacts their health in the long run.
What advice would you give to a new nursing instructor or those looking to enter community health education and how to get involved and what the best way to do that is?
I think number one is to find, again, what is your passion? What is your gift? What do you want to do? How do you want to give? So maybe you used to play softball or soccer. I have another student who said, yeah, and so I actually a coach for a soccer team for students with disabilities. I said, well, don't stop doing that. Mm-hmm. They need you. I said, nursing encompasses the whole community, everywhere and everybody at any time. So you can do something fun and still give back. I said, so again, you want to work? Yes. You want good education? Yes. You want a great job? Yes. But you want to have a great life because that's what we're trying to give people, the best life we can in their community.
So now we're going to move on to a fun segment.
Okay, let's go.
True or false. So we're going to read a statement. You tell me true or false and why, okay? Mm-hmm. All right, here's the first one. True or false. Community health focuses solely on treating individuals who are sick.
That is false. That's why we got immunizations, mobile units for breast cancer screening, health fairs. We are about health prevention and health promotion. And Benjamin Franklin was right. An ounce of prevention is worth more than a pound of cure.
I love that.
Wow, I like that
That's
too.
Awesome. So I got another one. Only nurses and doctors can make significant impact on community health outcomes. True or false?
Well, I would say that's false, right? Because many of us are in your own community. They're teachers, they're lawyers. How about gardeners? Mm-hmm. Okay? Mm-hmm. So the beauty of a garden can bring down your stress. How about getting to know your neighbor? You've added something to your community by being there and being present, walking with your neighbor, okay, who wants to get out I remember a neighbor, when I was walking during COVID, she just came out the house and she said, I miss my friends. I miss my friends. I said, well, anytime you see me walking, you come out that house and come on, I'll take you for a cruise around the block. And she's never forgotten that, right? Because somebody just took a moment in time to say, I got you.
Mm-hmm. True or false? Social determinants like housing, education, and income have zero effect on a person's health.
Well, now we know this to be false, right? Let's just even talk about the cost of insulin. Until a law was signed into effect, even if you had retired, even if you had what we call a good job with those good benefits, insulin was $600. In some cases, I've even heard from a graduate student how a father wasn't getting his blood pressure medicine in an effort to make sure his family was fed.
Mm-hmm.
You know, if you're in the rural community, 25 miles to the closest doctor, they can't get there. They may have issues of aging. They may not have a car. Don't make any assumptions that people can readily get there if they wanted to. It's just not true. So again, we got to think about those things, about access. Okay, if you go to urgent care, they don't all charge the same rate. So you got to know which one your insurance covers. And most people don't think about that until they have to go to urgent care. And depending upon the bill, they're like, oh, my goodness.
True or false? Vaccination campaigns and health screenings are a couple examples of community health initiatives.
They are. They absolutely are. And once again, I encourage people to go because there's a lot of falsehoods of, well, I know my blood pressure's up because I have a headache. And that's not true for everyone. So then I said, what is your blood pressure? Oh, I don't know. I don't take it. Here's a free health screening you can go to right at your church, your place of worship, or at the mall. And again, these are good. When I say good health screenings, I mean, we're talking about Dopplers to check your veins and your kidneys. It's not just a hi, how you doing? It's about getting a smoke detector in your house, getting you on the list. Some health fairs, how about employment? Mm-hmm. That's health. Okay, so again, I've attended a lot of health fairs, just with different organizations, and we've talked about the need to have not just health, but let's bring the entrepreneurs of the neighborhood, the gardener, the person that might make soap or whatever. Again, right here in your community, or beauty products, whatever that might be. So there's that sense of community that gets back in there, and they've got someone to connect to. Maybe it's tea time or coffee time at the community house or at a certain restaurant that a vendor is willing to have. That keeps people connected because the number one worldwide diagnosis for many is loneliness. Mm-hmm. So why not connect people in a place that's right there in their neighborhood? So again, if we can prevent something, we're better off. I think that's me this time. And in doing so, again, if I'm with you and your blood pressure's up, when's the last time you've been to the doctor? I'll go with you. Mm-hmm. And again, for all that we know, as I was talking with the students about health screenings and health promotions, I asked them, why don't people go? And the students got it right on the head. They don't want to know. I said, yeah, it's scared. They're scared. Mm-hmm. But if I go with you, we can handle it.
Mm-hmm. That's very true.
Yeah.
It's very real. And that connection piece that you talked about too, it just goes back to they're not going to be open and honest with you and tell you what their needs are unless you have that initial connection and that initial trusting relationship where they can say, I am struggling with paying for my medications. Mm-hmm. I don't want to go because I have anxiety about what the results will be. Mm-hmm. But we can be that nurse. We can be that strong advocate for them who can be their support system when they don't have anybody.
Exactly.
I love that.
So one last true and false question. Community health is only concerned with physical health and does not address mental or environmental health.
And that is so not true. Number one, when we're talking about mental health, we're talking about not just depression, but we're also talking about cognitive and emotional disorders, from dementia to autism. How do families cope, right? Number two, we talk about the issue of the environment, your home. A home built before 1978 is going to have lead in it. And stop making lead paint until 78. So this older home that's been in the family and you have children, once again, we're screening your child automatically, you know, at the doctor's office, encouraging you to do that so that we know what the lead is. How about PFAS that's coming down the river and contaminating the water, and has been, you know, again, through these groundswell groups saying, hey, we got to do something about this water. And it's our lives and it's our health that's at stake.
Oh, that was great. I tell you, I feel like this has been an awesome conversation today. It's great to hear all about the impact you're making out there in the community and with your students, and really fostering that love of the community and your students that can then go out and make an impact all around the United States. I think that's fantastic.
Yes, and thank you for having me. And listen, folks, let me tell you, when you have friends like this, it is a conversation. It is not work, but it is sharing, and that's what we're all to do. Because, again, I learn from my colleagues, and they learn from me. So it's been a great day, and take care till we meet again.
Likewise. To find your breaking news and latest updates within the College of Nursing, please refer to our website at nursing.msu.edu. You can also find us on all social media platforms at MICHST Nursing. Who will?
Spartan Nurses will.